Let's walk through the setup of routine liver abdomen MRI exam. So first of all, I will start way before I go into zone 4. I have to demetalize myself, making sure nothing is in my pocket, some ferrous loose objects like coins or pins. Also making sure my wallet is not on me. The same goes for electronic devices like my watch, cell phone. So that actually has to go out of my pockets from my body. After that, I will check the doctor's orders for the next patient. This will help me to verify I'm talking about the right exam, and also what kind of coil I'm supposed to prepare. So with this knowledge and demetallized, I walk into zone 4, disinfect all the surfaces that we touch on a regular basis. That includes the scan table, inside the scanner, the pillowcases and the sheets are brand new. I will prepare power injector, saline, contrast. Then I will be ready for the patient. I will follow the protocol AIDT, starting with acknowledgement, introducing myself, then explaining duration to the patient, also explaining the procedure. Then also I make sure that patient understand that he or she has to put all their belongings and valuables in the locker. They have to change in the hospital gowns. Also, we make sure that if they need a contrast, I get the consent for the contrast. Also, I make sure that patient is given the hearing protection, appropriate padding. It's very important to give them the squeeze ball, emergency squeeze ball as well. And I will start an IV when needed. For this exam, I will use phase array abdomen or torso coil. The coil will be placed on the armpit level. This phased array coil would be my first choice because it covers a pretty large area. So to describe it shortly, is that particular coil has two parts, anterior and posterior. Part of this coil will go under the patient will lay on it, and the anterior part would just cover the patient from the top. However, there are some scanners that already have the coil, the spinal coil embedded in MRI bed. So for this, in these circumstances, is pretty straightforward. All we have is the top coil that they put on top of the patient. For liver/abdomen exam, we place a patient on their back, meaning supine, and again it depends on the requirements of the facility, or if we have choice, it doesn't matter if they go head or feet first. Usually we do it arms down, the patient goes arms down, but some facilities require arms up, so we follow the requirements. I let patient know that he or she would be holding the breath during the exam. I'll tell them when, and also it will help if I hold my breath with them to make sure I know what they're going through, and to give me the clear picture of the timing. It is much easier to hold the breath on when we inhale and then hold the breath, opposed to when we exhale and hold the breath. The last one is much, much harder. The laser mark for liver abdominal exam would be sphenoid process of the sternum, and it's pretty easy to describe. It's that bone where the on the chest, upper chest area, where the ribs start like growing apart, separating. One of the sequences I described, it's respiratory triggered sequence. I already ran the Scout, which is a low resolution image where I plan just approximately my scans. And this particular sequence free breathing would be pretty straightforward. It will cover the dome of the liver. We cover from dome of the liver through the inferior liver or kidneys. It depends on the site. The field of view supposed to cover all the soft tissue, meaning the entire abdomen. Angulation and coverage for coronal breath hold sequences. Coronal breath hold sequence will allow us to know where the liver and other abdominal organs are located during the inspiration. Field of view should include the dome of the liver, sometimes to the iliac crest of the pelvis. Slice coverage should include all the soft tissues of the abdomen. I will use a coronal breath hold sequence to see where the liver is located upon inspiration. And that's how I will plan my axial sequence. Field of view has to include all the soft tissues of the abdomen. The slice coverage should include dome of the liver and the kidneys. It is crucial for us to use power injector in these exams because it gives us precision, first of all. The thing is, we have to inject contrast gadolinium at the very precise rate, and to do it by hand, it's close to impossible. Plus, the gadolinium is a very thick syrup-like substance, so it's extremely difficult to do it by hand, and that's why we need an injector. So injector is a great tool for us in that case because it's just like a timer and like a machine that can precisely set up all kinds of intervals for us, and we don't have to worry about anything else. For example, we do post-injection images, and again, injector here is extremely valuable for the timing precision. We can do 1 minute after, 3 minutes after, 5 minutes after, 20 minutes after, post-imaging. So it's just an awesome tool. The bottom line is that we do a lot of dynamic imaging on abdomen, and power injector is just a priceless tool for us here. It is necessary to mention several important aspects, safety, injecting gadolinium, or injecting contrast in general. As I mentioned, we use a power injector, and there are several things that are necessary to keep in mind in order to keep patients safe. We don't want to spread any infection, give it to patient, as well as cause their air embolism. So it is pretty straightforward things. we can do in order to keep everything right in place. So everything we have to keep clean, and if we don't use it right away, we prepare it. There are caps that we put on protecting those parts that will go in patient's vein. And also we use saline to flush the tubing. It serves several purposes. We clean it that way, and also if we flush saline and it shows up on the other end of the tubing before the contrast shows up, we don't want to waste the contrast. So when saline is showing on the other end, it means it pushed out all the air out of tubing, and this way we are not going to put any air into the patient. Also, we need to keep in mind that it is necessary to have the gauge of the angiocatheter not less than 22. So this way we will not blow up the patient's vein. Let's walk through preparing the pelvis MRI exam. First of all, we do metallize ourselves. I would check all my pockets for any items that are not allowed in zone 4. It's a ferrous, loose items, credit cards. So I will remove my wallet, my watch, because it's an electronic device. The battery will be drained, as well as my cell phone, keys, all kinds of things. Just whatever little stuff can actually end up in my pockets accidentally, it has to go out and left out of the zone 4. Also, I will check my patient's order, doctor's order requisition, to see what the diagnosis is, make sure everything is matching, and this way I will know what coil to prepare. Also, I will disinfect everything, wipe every surfaces off, the ones that been touched by previous patient, by me. That would be a scan table, inside the coil bore, all the little, even tiny areas, just to make sure everything is clean, like being very thorough. Also, of course, the pillowcase, we're gonna go the new linens. I will be also putting for the new patient. And when I am ready for the patient, I will go out and use the protocol, the acknowledge, identify myself, duration, then explaining the procedure to the patient, and at the end of the exam it will be thank you. So also at this point I will talk to the patient. I will explain to him or her that they have to change from street clothes into the hospital gowns. They have a locker to lock all their items, clothing, valuables, and also make sure we both sign the forms, and also I'll explain the patient how long the scan will be. I'll provide the patient with necessary padding, with hearing protection, with the emergency squeeze ball. I'll make sure the patient knows that they're not alone, and I can always be there to help So that's what the squeeze ball is for. Also, I make sure that the patient went to the bathroom prior, and just offer to go to the bathroom again if there is need for that. At the end, I will make sure the patient is comfortable. Also, I give the patient the chance to ask me any questions they have. And that's pretty much it. We are ready for exam. So let's talk about what coil will be used for exam for the pelvis. It will be a phased array, abdomen coil or torso coil. The coil must be covering the top of the pelvis all the way to under the groin. We have stripes for this type of coils, and those stripes are meant not to be tight. They just used to make sure that a coil doesn't slide on one side or another side. So in other words, stripes should not be tight. The patient is positioned on its back, meaning supine. Again, we have a choice to put the patient into the scanner head first or feet first. Sometimes the patient have their own preferences. Some of them are claustrophobic, so we don't actually, it's not like a set in stone, is it head first or feet first. It can be either way. The landmark for us with the MRI of the pelvis would be mid-pelvis. And there is one easy way to determine that without actually touching the patient. It's a pretty sensitive area. So we'll just ask the patient to bend their knees. So the knees are actually, the legs are like the 90 degree angle towards the table, and where that angle starts, your body and the legs, that's where our landmark is going to be. It's pretty straightforward. Angulation and coverage for axial sequence of the pelvic exam. We will cover from iliac crest to the ischial tuberosities, or through the all soft tissue of the pelvis. It depends on the site. Field of view should include the whole pelvis area, meaning entire bony pelvis, and possibly adjacent muscular fascias. It will be dependent on the protocol. And angulation would be perpendicular to L spine. Angulation and coverage for sagittal sequence, we will cover at least through the all bony tissue. Also, some sites can include the soft tissue as well. The field of view will include the entire bony pelvis, above the iliac crest, all the way to ischial tuberosities. We will angle between the hip joints to create the real sagittal image when we separate left side from the right side. Angulation and coverage for coronal pelvis sequence. Again, we cover through all the bony tissue. Some sites will include soft tissues. Field of view will include the entire bony pelvis, bony tissue, above the iliac crest and all the way under the ischial tuberosities. And then we will angle between the hip joints to create the really coronal view slice.